across London, which is a set of case studies and a how-to guide on how to work with local anchor networks to create community benefit, and some examples of how that's already being done in parts of London. If you can go on to the next slide, please. Yeah, that is the report, which is just fresh on the London Anchor Institutions Network website today, and we will share the link in the chat as we go through, so that you can look at the documents and have a read. So the report is really just a snapshot, scratching the surface of the experience we know is happening across London. Next slide, please, Katerina. But that's why we're really, really excited to be here today with all of you, and delighted to have been invited for your last session before Christmas, because we know there is a huge amount of experience out there all across London, and we want to give you an opportunity in the breakout group to share it with us and to share it with each other too. Next slide, please. I love doing this, the Chris Whitty bit. So through the case studies that we gathered with some great support from Bloomberg Associates, and I hope that one of our colleagues from Bloomberg might be able to join us later on in the session, we found that there are a whole range of different ways of doing this kind of work with anchors in places in London. And in particular, we found there's a real spectrum of approaches, from quite informal ways of building networks and working with networks. Informal, emergent, we've called them fledgling. Little things that need to be nurtured and protected. But that goes right through to a much more structured, much more mature approach. And we're not saying that either of those is the right way to do it. We're just saying there are different ways to do it. And there are different things that will work best at different times. Sometimes a fledgling network might grow into a more mature one, but sometimes a fledgling approach might be just what's needed in a particular situation to make a real difference in a local community. I'm loving seeing all the introductions going on in the chat, including some from over in the USA. And obviously, with our work being supported by Bloomberg, we've had the benefit of examples, not just from London, but from other parts of the world too. And it's brilliant to be able to draw on that here as well. So if you can take me on to the next slide, that brings me on to our how-to guide. And look, this is not intended to be prescriptive. It's drawn from our case studies, but I think it's fair to say that none of the case studies followed this line by line. It's a kind of best of the best set of steps that you could follow in this kind of logical order. Let me talk through this briefly, laying the foundations. What we found from all the examples and all the case studies that we gathered, that getting started is often a struggle in this way of working. But starting with values can be a really important way to do it, because that's a way of bringing people together around something that unites them. What can also be really good, but I think personally is the bit that often gets missed, is start with data. Start with a baseline assessment of the thing that you want to change about your place, the benefit that you want to build, and do a baseline assessment, because that will help later when it comes to seeing the progress that you've made. Set yourself an agenda. It's really important to be focused. This is not about setting up general partnership meetings to have an overview of everything that's going on in a place. It's about having a mission, having something really, really clear and tangible that you want to achieve, and using this as an implementation tool to make change happen. Building a team, one of the interesting bits of learning for me, you know, coming from London councils, we often think of local authority leadership in this space. And that is, you know, many of our examples come from that direction. But actually, anyone can be a leader when it comes to this sort of anchor work in creating networks. And we'll hear very shortly from Michael from an anchor perspective about the sort of work that the NHS is increasingly doing across London. Making commitments. So it's really easy to get people together to have general goodwill and general intent to want to make a difference in places, but getting to tangible commitments is much harder, but actually that's what can make a difference. generally making a commitment to recruit more people from your local area is an easy commitment to give. A specific commitment that there will be 30% more hires from a particular area within a specified time period is something you can hold yourself to account for. So getting to that tangible stuff is hard, but really important. And because it's hard, it's a struggle to get started and it's hard to make progress, it's really, really important to celebrate your wins and gain some momentum. Measuring progress, it's about the data again, really important part of it, having some metrics and tracking them. There's ways of connecting to kind of citywide targets in this kind of space, and you can find out more about those on the London Anchor Institutions Network website. And then building on success. Lots of the examples in the report were about starting from a really clear need, many of them driven out of the pandemic. Great example from West London, of the West London Alliance and their work with the NHS, when really significant recruitment needs emerged over the pandemic and how they worked together to make that happen. Similarly, in Tower Hamlets, where they took the opportunity of the Kickstarter programme to build an anchor network around their employment challenges in the area, and a really emergent and really positive partnership emerged from that. So you can start with that initial driver and grow over time in all sorts of different directions. There is no one right way of doing this, and that is certainly what we found. So that's our how-to guide. You can read more of it in the link, but I'm now going to hand over to Michael to talk a little bit about the NHS perspective. If you can go on to the next slide, please, Katerina.
Thanks, Gillian, and great to meet you all. And yes, so I representing the NHS in London, and I go up and down the country talking to NHS colleagues about their role as an anchor in local communities. And I think the starting point for me is we're probably quite late to the party on this. You know, we are up and down the country in every town, city, village. We have huge economic and social influence as a sector, but often it went under the radar. We thought about our services, not the additionality of what comes over and above our services. So we've been working in London for the past few years, and I think there's some really interesting drivers here which align, Gillian, with the points you made. Actually, what one driver for what we do, I remember the advent of COVID, the Chief Executive of NHS London being invited onto the London Recovery Board, as a civic leader, and that started permeating through. The discussions were not when the Mayor and the Chief Executive of NHS London met. They weren't around reconfiguration, they were around jobs. And I think that sort of flowing through our decisions and our understanding and our board level discussions was a realisation that we have a real part to play in narrowing the inequalities in London, and we also benefit from narrowing the inequalities in London. So we're working at a few different levels. Building on some of what Gillian said, we knew we had to do something at the London level, and that involved leading on certain issues where we thought that the data showed us it was right to do. We knew we could make an impact, and we could align with, for example, the Mayor's wider priorities. And what's interesting there, we were trying to balance a social movement with business as usual. Social movements, many NHS leaders get excited by this, but the NHS is hugely complicated. It's a real bureaucratic beast. If we don't change how the NHS works, all of this is just hot air. And likewise, we couldn't just tinker with our structures without that vision and that excitement. So it's a real balance. And I think some of the things I'll say, we started relatively small and quite narrowly focused around workforce, around procurement, where we knew we could move the dial. Some of the biggest wins and the speed of which we've moved the most has come where we've partnered with the Mayor and with other anchors. And I think actually that, interestingly, the agenda moving outside the NHS has shown NHS leaders where we should be adding value and the speed at which we should be working. So we started small, we've built up, we've made a range of commitments, and these are commitments that the NHS in London cannot do by itself, because these are about living wage. Now, we have statutory NHS hospitals and organisations, it's their decision to sign up for the living wage, but we can have a target of 75% by next March. We can convene, we can try and bust some myths, we can work with partners to really make local leaders realise the value of this. We've now established a team centrally. So previously it was a bit of a sort of beg, steal and borrow approach. We've got a team at London level now that's there supporting, convening. We're digging out bits of central underspend, which we can ask our local systems to try and utilise. We're working at the London level, and that really is about partnership and convening and championing this. We're working across the 5 systems, and if you're joining from London, you'll be one of the 5 integrated care systems. Where's your voice in that? And of course, we're trying to support ground up NHS organisations, not just trusts, but think of primary care colleagues too, to understand and play their part. So you can see there needs to be an echo, I would say, between all those layers. And on this slide, the last thing I'll say, Gillian, on the 3 points on the left, which I try and get our leaders just to realise, this isn't the NHS saying, we're here, what can we do? It's about being humble and saying, actually, can we join your conversations? We're probably late to the party on this. What can we do? So there's an agility. The NHS is great at sort of operationalising things and carrying on. Well, actually, if the context in which we operate changes, we have to be responsive to that and understand where we can add value. Humility and adaptability. Often the NHS doesn't stop doing things, and I'm trying to get London just to bring a bit of that cultural change. And then when it's the right time, stop. It should be in the business as usual. In the architecture now, we should be able to look at what else we can do. So I'll leave it there. I'm really happy to talk about this. I'm looking forward to the discussion, Gillian. But we want to work with you. We cannot achieve anything as a service by ourselves, and that's at the London level, the system level, and down in the wards of our local boroughs.
Great. Thank you for sharing that, Michael. And I've just been watching the chat and just seeing the range of people who've joined. We have such a wealth of experience in the group, which is fantastic. That actually brings us on to time to go into some groups to share your own experiences. And Katerina, if you can take us on to the next slide, you will see the questions that we're posing for you. So this is an opportunity, as we said, to share your experiences of working with local anchor networks, creating partnerships. What went well? Did you find it a struggle? What were the challenges? Does the how-to guide resonate? Does Michael's experience resonate? What I would also ask is, if this is just all completely new to you, if you've come along because you want to learn, does the how-to guide help? Does it tell you where to start? And if not, what support and resources do you think would be needed to help promote more of this kind of working across London? And if you have got experience, would you be willing to take part in a kind of community of practice, continuing this process of sharing and learning from each other? Because that's something we are really keen to generate out of this work. So just a few short questions for you. And I think we're going to take about 20 minutes to do that. Can we be magically spun into breakout groups?
So the breakout room functionality is making me do it manually. Unfortunately, there's a Teams issue, so it might take a bit longer. So bear with me for a moment while I add people in.
Gillian, are you also able to kind of put the questions in the chat so that people kind of, copy paste it onto somewhere where they can have a look at it?
That's a good idea. Can I do that?
I can probably find them in the.
Well, while we're being put into chats, does anyone want to share their experiences or ask any questions now in the open group? That would be very welcome as well.
Oh, sorry, they look a bit weird there. See if we can make them not look like that.
There's an open question from Michael about people's experience of working with the NHS in this kind of space. And I know Michael won't mind me saying that People don't always traditionally find the NHS the easiest of partner to work with. So now is your chance to ask for any tips or share your experiences, whether really positive or whether there are challenges.
And I think, Gillian, it's that point, isn't it, about being by being an anchor, you're fixed, so you have a huge role in place shaping, and actually by going through this process you learn about your own role. You almost see, the value of an anchor is often seen by your partners, not by yourself. So actually it may well be that if we're making decisions at board level which are place blind, we may actually be exacerbating local inequalities. We may be making our partners' jobs harder. So I think that's what the multi-sector purpose of this is, is about reaching out and supporting each other and challenging each other, actually. And that's what we as citizens want, I think, isn't it? We want our anchors to be challenging each other locally to make decisions which benefit our collective populations.
Yeah, thanks, Michael. Soraya.
I've seen a question in the chat about sort of kind of getting at what the definition of anchor networks is, and I thought I might come in with a bit of a perspective on that. So the way we see it is that an anchor institution is essentially an institution that is really rooted in a particular place and in a particular community. But not just that, it has a sort of scale of workforce, of estates, and of purchasing power, which it can use to generate positive social and economic benefit. And an anchor network is when those anchor institutions come together and sort of leverage that recruitment, procurement, and estate management capacity towards a set of shared goals that they kind of define collectively. And I think that's the way that we are approaching it at the both at the kind of citywide scale here in London and at the sub-regional and local levels, is identifying who those anchor institutions are and kind of convening them around a sense of shared purpose or mission in order to develop a local place and make it more inclusive, make it more prosperous, make it healthier, make it more sustainable for that local community. And as Michael was saying, doing that actually ends up benefiting not just the sort of the wider community, but actually the organisations themselves. It's inevitably in an organisation's interest, whether it's a public sector organisation or a private sector organisation, to have a more cohesive, cleaner, greener, healthier, and more prosperous community in which to operate. If you're a private sector organisation, it means you have a more prosperous customer base to draw on. If you're a service provider, it means probably ultimately you need to provide less in the way of services because your communities have fewer needs. So it's a win-win approach if we can get everybody working together on it.
I think we also have some questions that popped up in the chat. So kind of someone's asking what role universities can play as like an anchor institution or like in an anchor network, and how they might contribute.
I'm happy to come in on that if you like, Gillian, as well, because
yeah,
we have.
Please go ahead. Thank you.
So we've got some really great examples of this in London at the local, sub-regional, and citywide scale. So the way universities are approaching this in London, they've been terming this civic university agreements, and they've been establishing these with local partners. For example, Goldsmith has one with the London Borough of Lewisham. Queen Mary University has one that's focused on a sort of slightly wider catchment within East London. And then we have the University of London, which represents 17 individual universities and colleges collaborating with us at the London-wide level through the London Anchor Institutions Network. And essentially, universities have a huge role to play in leveraging many of those things that I talked about earlier. They often have very large estates, and the way they manage those estates has an impact on their communities. in terms of not, for example, their carbon emissions, in terms of the sort of active frontage they provide on the street, in terms of incubation space that they can offer for small businesses, in terms of cultural activity that kind of activates a local area. They have a role to play in terms of their own recruitment practices, how they hire from the local community, whether they have recruitment policies that remove barriers to underrepresented groups accessing work. They have a role to play as well in terms of how they purchase, whether they buy from small, micro and diverse owned businesses locally. There are so many ways in which they can actively engage with their local community and help to build a better place. And the really encouraging thing is that we're seeing more and more of this type of work happening across London with our own universities.
And just on that point, so some universities actually have civic, there is a pro vice chancellor, that executive leadership for the civic issue, and they may well have teams. I'm thinking King's has someone who actually leads on this at their university. So I think that's an institutional challenge. I know many NHS organisations might have a dedicated anchor lead. It may sit with strategy. In some instances, it may well be it's the HR, the recruitment part of the NHS organisation, given we are pretty much the biggest employer that actually has most of the links. We're trying to get, I guess, strategies understanding the anchor concept, and we want this to be moored at the centre of an institution, not just in one of its operational tentacles. But of course, resource differs across different organisations, but we're trying to get, the social value and the workforce and all different, and the estates all linked around a common agenda for this. And that's quite difficult within a trust, let alone across a huge city.
Yeah, I see there's a question in the chat from Elizabeth about it sounding very similar to place-based imperatives proposed by the last Labour government. Are you talking about a kind of total place approach, Elizabeth?
Yes, that was it.
Yeah,
I couldn't remember the name. Yeah, total place. So I had a recollection. I think for colleagues who don't remember, or indeed maybe too young to have ever remembered, the last Labour government, I believe, towards the end of its period in office, brought in total place, and the idea was, exactly that local organisations, health, education, policing, local authority, etc., should actually work more closely together on joint delivery plans, setting out against common missions, that type of thing. I'm very new to what you are describing here. That's why I joined your call. Thank you. And I was just wondering, is what you are talking about a more modern version of that, and or does it also reach out, which it sounds to like it does, to the private sector and the third sector to be involved, both in the conversations and in the delivery?
Yeah, definitely. I mean, I think I would, so I am old enough to remember Total Place, definitely. And I think the difference for me is that Total Place was very much a kind of government policy agenda, quite focused on sort of public sector delivery, quite focused on budgets as well. It was a way of saying how much money is the state spending in a place and how could it be spent better? If people work together differently, would it shift money into prevention rather than into responding? How could that work in a different way? Whereas what we're talking about here is definitely, as you say, about reaching beyond the public sector into the private sector, working with big businesses as anchors, universities, as well as community groups is very much part of it. And we're proposing an approach that is quite kind of mission-based and quite focused on making specific changes, coming together around a set of values, a common problem, and saying, how can we come together and make a contribution to this place that we are part of, lots of the examples that we've come up with and that we've happened to have found and shared have emerged from that COVID context and COVID recovery. It was in that context that the Anchor Institutions Network and this place-based group were established. But we're moving on from that now. The city faces many different challenges, some of which predated COVID, and some of which have emerged more recently. And we think this is an approach that can work more generally too.
Really helpful, thank you. And apologies, if you don't mind, if I could just ask the second question I put in the chat bar, because it might be relevant, which is, again, where I live, which isn't in the London area anymore. We have a local plan which was developed by a local community project team as part of the National Planning NPPF. Can't remember now what that stands for. But in that, we've obviously, through consultation with the community, we've set out what the community wants by way of education provision, health provision, nighttime economy, how it wants its place to be. Do you see there as being a direct link between what the community has already said, where such plans exist, and what a network then might take forward, or are they separate things?
Yeah, I mean, certainly I could see creating an anchors network as something that emerges from well done, Soraya, that emerges from a local planning discussion. That would be a great way for something to be generated. But it would be setting up a specific separate kind of mission focused task as part of that. But yeah, it could certainly be generated from a planning conversation. That would be a great place for it to start.
That's great. Thanks, Gillian. And apologies, I'll give the floor back to others. Thank you. That's really helpful.
No, thank you.
Just on that point, I was going to say that local authorities have a responsibility to develop those local plans in consultation and in partnership with their local communities. And I think the role of councils in this agenda is really interesting, because borough councils or county councils, whatever they may be, are anchor institutions themselves, and they are also conveners of anchor networks locally. So they have their own role to play in terms of the quality of the work that they offer to their employees, in terms of how they purchase, in terms of how they manage their estates. But they also have a role to play in bringing other anchors together locally around those kind of shared objectives for a local place, which are often set out in a local plan or in other statutory or other strategy documents that a council produces. And I think that's a really interesting dual role that they have to play.
I would love to pick up, there's a thread in the chat started by Mia, but with lots of thumbs up around it and lots of comments about how local residents, perhaps those who are marginalised and not represented by established community groups, can get their experiences heard. And I would love to hear from anyone who wants to talk more about their experience of that. And because I think, you are perhaps responding to the point about anchor networks can involve community groups, but how do we bring people to the table? How do we get voices heard from people who are not part of that established network? Is anyone able to come in with their examples?
I put the comment up, and I can just sort of make a point about it. I mean, I was working recently on a big program about health inequality, and one of the hypotheses we had was that health inequality seems to occur in groups who perhaps haven't yet got a diagnosis of a chronic disease, but it's like a ticking time bomb. If they carry on eating, you know, food heavy in saturated fats, if they carry on smoking, if they carry on taking drugs, you know, it will happen sometime, you know, in the future. And it was actually engaging with people, and, you know, the clinicians that we were working in with the NHS were very right. Okay, well, you know, they must do this because, you know, they must get their HbA1c down and they must do that, and didn't actually find out what people's motivations were. So we engaged a recruitment group and said, right, okay, we want people. We had to pay for it, obviously. We want you to find us people in this age group, you know, in this income demographic, you know, who have got unhealthy lifestyle behaviours and everything. And then did, you know, sort of some focus groups, some one-to-one interviews. You know, one of the best interviews was on WhatsApp. Nobody spoke, you know, it was just back and forth and everything, because that's where the person felt comfortable. There's something about meeting people where they are and not saying, right, we're having a community meeting here and it's going to be in the town hall and it's at this time and everything, because only very, very motivated people will come along to those things. And if you are trying to access a demographic who perhaps have low education or a lower income, they may not have the confidence, or they may be on a 0 hours contract, and maybe they did want to come along, but if they've got an offer of work, they're going to go with the offer of work because they need to put food on the table. And so it's just trying to find different ways and trying to use different routes to get into people, so that you're not just representing the views in the community of people who are like the same old suspects who come along to all the meetings and everything. There needs to be a more imaginative and more nuanced strategy to actually reach different people. You're on mute, Julian.
Hello.
Thanks. Yes, apologies for that. I was just checking in on my questions to see whether we are covering the things that we wanted to cover. I mean, I'm getting from the chat that there is lots of people who've come along who are interested in kind of learning more, and I'm wondering whether you can say a bit about what you think would be helpful as ways of learning more. We hope that you'll take a look at the report when you've got some time and the case studies that are in there. That might give you some inspiration, but what else would be helpful to people in terms of just trying to make a start at some of this kind of work?
Hello.
Hi, come in.
Hi. So in my local authority, I'm actually a person with lived experience with the social service. So we run this group, a parent group, for almost 9 years now. So all our member is with lived experience, and we co-design with the local authority in helping training social worker, you know, and we also do a lot of other activities with the local authority. And myself also got trained as parent advocate. So we have very good relationship from these people, and our group is expanding, and we involve with lots of researchers as well. And we are co-production with the LA. We also create this parent advocate role. So I'm now actually working with the local authority. So I think yeah, it does work, and people are willing to participate, but you just I think the local authority, they have to be able to go into the community, find the people, invite them to share their experience with you in order to help to change what they want to change, you know. Citizens are ready to speak, but they don't know where to find the channel. So I think the local authority has to have the initiative to start this conversation. Thank you.
Thank you. Yeah, and I can see in the chat lots of interest in that theme around how you engage communities, how you meet people where they are, how network priorities can be co-designed with communities, and certainly in the kind of best of the best examples that we've seen, being really embedded in communities, and responding to what communities think is important in their areas is part of it. But one of the examples you will read about in the report is from Camden, and I know from the cast list that we've got some people from Camden here, and Camden is definitely at the mature end of the spectrum that we've described in terms of the way it works with its anchor institutions, from universities through to local businesses through to community groups, and has undertaken that work in a really structured way, really embedding that work with communities and with anchors into its strategy. So I would encourage you to take a look at that. Yeah, and lots of fantastic examples in there in the chat about sort of community of practices. I like that suggestion, Beth. Thank you. But expanding that, not just from professional anchors into working with service units and the local community. That sounds like a great development of it. Yeah, thank you, Sarah. Co-production and collaboration rather than consultation. Completely agree.
I just wanted to mention also that for some technical issues, glitch in Teams or something like that, unfortunately we couldn't make the breakout rooms work. So if it's okay with you, Julian, that we kind of continue this discussion. So any questions you have, put them in the chat, raise your hand, and we will pick up on them.
Yeah, thank you, Katerina. I was kind of assuming that we were just continuing talking, which is great. Anais wants to come in.
Hi, yeah. So just kind of going back to the idea of like bringing different stakeholders across, different sectors together. A lot of the comments so far have been about kind of like separating the professionals and the community, and I think that's kind of part of the problem. And whilst like co-production, co-design is amazing and should be the way that we do things, I think ideally, really, it should be there's also a progression for service users to then become the professionals themselves, to then be the ones that are designing it and are the ones that kind of like, and there's that kind of cycle, and we're looking at community holistically, and that's where you get the buy-in from businesses and from hard to reach communities, and it's like where you build that trust, where you see that you all have a part to play and you're all respected. And I think it's what I always kind of say, it always goes back to like there's not enough communication, clear communication about what is happening and what the purpose of people's involvement in things, and there's no follow through at the end of like, this is thank you for taking part in this has been your role, this has been the outcome, this is what we've done as a result, and that's because you were in part of this process. I think oftentimes the last bit gets lost where things get done, but they don't then get communicated back to the people that were involved in terms of like, here's why we wanted to hear from you and here's what's happened, and that kind of ongoing piece of work which builds the trust, which gets more people wanting to be involved in that kind of work, and help support things. I think so in my role, I'm one of the voluntary community sector coordinators at Haringey, and we kind of lead on quite a few different community networks. So we've got a Haringey Community Food Network, we've got an LGBTQIA+ community network, a women's network, a Latin American, the list goes on. And I think what's really difficult is that when you're working predominantly with the voluntary sector, is that they're already giving up so much of their time to be there, that the expectation is for the local authority to do the bulk of the work. And so there's a fine line of like having, residents of voluntary sector involved in co-designing, co-production, and then being like, it's not our job to do this, it's your job to understand. And so it's hard, like, well, we need you to tell us so that we can understand. And so I think really it's about, we need people with lived experience in those roles so that they can then share, and we're not relying on people to tell their, their lived experience as a way of almost like feeling like they're being used. It's like the intention is good, but I think a lot of the time it's not received in that way. Anyway, sorry, end of my rant.
Yeah,
there.
thank you. No, great points. And there's a sort of theme about momentum coming through the chat as well. And I recognise what you're saying about the voluntary and community sector, not necessarily having the resources to keep up momentum. I think the same could be said actually, and we've got some examples of this in the report as well, for business. You know, keeping up that momentum is pretty challenging. A lot of businesses really went the extra mile in the aftermath of COVID as we came into recovery. Actually, for businesses, they're now facing, as residents are too, real challenges around cost of living. That extra bandwidth that they might have brought to the table for some of these initiatives isn't always there. So I think that's why we often see the momentum and the drive coming from local authorities, and that sort of ongoing leadership is something that local authorities can really provide and kind of keep things going. I think there's also a point about momentum, like knowing when to stop is quite important too. We had lots of conversations as a group in sharing experiences about times when anchor type or partnership projects have kind of just gone on for too long and have gone beyond their initial mission. They've gone from that focus on getting things done and just become meetings for the sake of meetings. We found a real frustration with meetings for the sake of meetings, which I can see some nods on the chat already about that too. So actually knowing when to call things a day and say, well, you know, we've achieved what we wanted to achieve here, and perhaps restart on a different challenge with a different group around the table. And also accepting, you know, people will make whatever commitment they're able to make, and that's okay, and that you can be fluid and you can be responsive and flexible too. I can see Soraya wants to come in as well, so so do come in, and I'm going to catch up with the chat.
Just on that point of about momentum as well, I think it's something about firstly celebrating and showcasing the wins that come about from this way of working, because they inspire others and they generate a momentum. They help to generate a momentum of their own. But the other thing I was going to say is also about it's proof of concept, really. The point I was making earlier about how this way of working ends up being beneficial to the anchor institutions themselves. It's some of you may be familiar with the data that shows that, for example, organisations that become London living wage accredited and start paying the living wage to their employees find that they have better retention, you know, fewer sickness days, a more productive workforce, and so on and so forth. It's those kinds of actions that anchors can take that actually end up benefiting themselves as much as the community. Means that this can also become self-sustaining, because if you have a happier and more productive workforce, if you have a diverse and supply chain that's offering you a great quality service because those SMEs are excited to be winning those contracts and are working hard to deliver on them, then you benefit as much as the community does, and that's self-sustaining.
Thank you, Soraya. Really great points about how you can keep some energy around things, and celebrating success, definitely an important part of it. Can I throw in one other theme and see if I can get any reactions or questions around it, and then we will need to go on to our kind of closing stages. In the how-to guide, I talked about data at a few points. I talked about getting your baseline right, having some clear metrics, having that sort of tangible driver for progress, and that can connect to momentum and success as well. Does anyone have any experience that they can share of using data to good effect in that way, or is data just really difficult? Is data really challenging? Don't know whether to take silence as meaning data is challenging. I think data can be quite challenging. It's quite a hard part of it all. Sarah, yeah.
Yeah, hi. Sorry, it's just it's an interesting one. So like my role is co-production and participation work in the community, quite predominantly with young people, but parents as well and other residents. So and I think it's a very interesting balance. I think there's a tendency I'm not going to generalize, but sometimes there's a tendency and there is definitely a need to have data to back up, you know, this is proven, this is, you know, this is an actual thing that's happening and definitely something we need to address. But yeah, there has to be a very delicate balance. And that's always really tricky, I think, to find that balance between becoming too data driven and then you lose out on some of that qualitative engagement, really. Yeah, so my response is yes, it's tricky. Maybe that's why the silence. But it's an important aspect. But it's also having that data in a way that is relatable and easy to understand. So you really have to have a good understanding of like the motivations of the people in the room. And I'm not saying about manipulating data, but it's about how you present it and how you make it relatable, really. Which I feel a lot of academics, maybe by nature of being an academic and not necessarily being people facing a lot of the time, that they struggle with that. And I think that's where those relationships between academics and those of us that are more public facing kind of need to be sort of grown and built a bit more. So
yeah, brilliant. Yeah. I love Michael's comment in the chat that just echoes what you've been saying, that it's about names as well as numbers. And we need to remember that. I'm going to bring in Anna Davey. I hope I've said that right. And then I am going to hand over to Soraya to kind of close our section of this and tell you about next steps. But Anna Davey.
Hi everyone, you can call me Anna. I actually work with Sarah, so I'm not trying to be an echo chamber, but I think, you know, when you do, you know, the anchor work, participation work, co-production work, you know, the issue is the delicate balance between qualitative and quantitative data. And I think, you know, when you research so we work in partnership with, I want to say UCL and the University of Manchester. And, you know, all of our measures are mental health measures because that's the work that we do. Recently, we worked with a group who had quite complex SEND needs. And the argument was the measures are the measures, you know, and you read the measure and as I'm still neurodiverse, but like I struggle to understand the measure, let alone someone who doesn't have the same comprehension levels as myself. And I think that's why it's incredibly important to bring in, you know, stories. Stories are incredibly powerful. The background, like Sarah said, the motivations of the people, what they actually got from the group and how that's impacted their life, sort of short term, medium term, long term. Because again, with a lot of our research, we might never see those young people that we work with ever again. So how do we, if we're an early help program, which is what we are, how do we then know that the early intervention has done anything? Because we don't go back. So I think, yeah, data is an interesting one and it is difficult. And, you know, time is a valuable resource that I think a lot of us don't have. But yeah, that's me. Thank you.
Yeah, thank you. No, a great reminder that data, you know, data, it means lots of different things and stories. People's stories are an important part of that, and that's a great place to end because our case studies really are stories about places in London. So thank you very much for joining the conversation. Soraya, do you want to take us through just some final next steps? And Katerina, if you can put up our final slide, that would be great.
Give me 2 seconds.
Yeah. Happy to, and hopefully it's not too noisy where I am. I have moved. I don't know if this is any better than where I was previously. But essentially, yes. So there's a real richness of information in both the main report that Gillian talked about, and also and then that's supplemented by this very succinct and practical how-to guide. So we would really encourage you to take a look at both of those. I shared a link earlier in the chat to the page where they are on the Anchor's website. They're right at the top of our resources page. So please do have a look at those and at the case studies. We're always looking to build up more, collect more examples of what's working or the challenges that people have faced in London. So if you don't see kind of your local Anchor network represented in there and you think there's something that we should be featuring, then please let us know. The email address that you can contact is anchors@london.gov.uk, and that's if you'd like to be involved in this community of practice that's being established, but also if you have questions or you have examples that you'd like to put forwards as well for future kind of spotlighting to share with other colleagues. For those of you who are London-based and within London boroughs, a letter is going around to the boroughs from Councillor Georgia Gould, who chairs London Councils as well as being the leader of Camden Council, and she's writing out to her fellow leaders about the Anchor Institutions Network and a conference that we are holding at the end of January. And so we would really, and that's sort of inviting participants from boroughs. So we would really encourage you to encourage your leadership to sort of pick up that letter and get back to us and engage in the conference, because that conference will be bringing together a range of different Anchor institutions from across the city, and it's a really good opportunity for people to make those connections or deepen those connections where they already exist. And finally, I think we're hoping to run another of these sessions with this network, perhaps more focused on this kind of citywide scale of the Anchor Institutions Network. And I'm sure colleagues will circulate details of that when the time comes, but would welcome your engagement with that too.
Thank you so much. Yeah, and I know we kind of have 3 minutes left. But yeah, thank you so much everyone for attending today. As Ryan mentioned, there's some kind of ideas for future London Policy and Strategy Network kind of focused sessions on Anchor institutions down the pipeline. So keep an eye out both on our Eventbrite page, as well as our new blog that we kind of established a while ago, to kind of keep you posted. Keep you posted on kind of upcoming things, but also a bit of recaps and any links that you would like to share from your side as well. The recording will come up there. So yeah, I hope that you've all enjoyed today, and yeah, feel free to contact us with any ideas for future collaborations or joint sessions that you would be interested in hosting yourselves. Yeah, so thank you so much, everyone. Noah, do you want to add anything or?
No, thanks everyone for coming. I thought it was a really great event, and thanks to Gillian and Soraya and Michael as well.
Thank you for having us.
Thank you so much, everyone.